Bad, it hurts, it makes you feel absolutely awful. We're talking about the flu, and by now, you likely know somebody who has come down with it. Now at 5, the flu bug is nailing people all across the state of Nebraska. In fact, the federal health department puts us in the widespread category. Good evening, I'm Craig DeGrelli.
And I'm Jennifer Griswold. Almost 500 cases statewide confirmed in the week leading up to Christmas. Reporter Megan Hahn is live from the Durham Outpatient Center at Nebraska Medicine. She spoke with an infectious disease expert. Megan?
Typically, the flu season peaks about January or February and lasts about 4 weeks. But this year, Nebraska has seen a dramatic increase in cases much earlier than usual.
Shows that the incidence is just skyrocketing, going straight up the last couple weeks, and we just don't know right now whether that's going to even out and start to come down or whether it's going to keep going up for another few weeks.
Sick patients are filling the wait rooms of doctor offices as we enter the peak part of flu season. Nebraska right now is one of 36 states reporting widespread cases.
We know the predominant strain that's circulating right now is called an H3N2 strain. And from past experience, we know when we see that type of flu that it typically is a more severe kind of season.
The CDC says the H3N2 typically causes increased hospitalizations and deaths in older adults and young children. In Australia, preliminary reports show the flu vaccine at only 10% effective, but there are some precautions you can take to prevent the spread of flu. Stay home when you're sick, wash your hands often, and avoid touching your eyes, nose, or mouth.
But typically you have to inoculate that in order to get sick. So in other words, you touch something that's been contaminated, and then you touch your eye or your nose or your mouth, and then the virus can get in that way.
In Douglas County, the health department reports 300 cases of influenza in the week before Christmas. Health experts say it's unclear whether that trend in the number of cases will continue.
Flu seems to transmit more effectively when it's colder and drier, so that's clearly the conditions that we have during the winter. And obviously people congregating indoors because it's so cold outdoors may have some effect on the transmission.
Health experts say you can be contagious and spread the illness for about a day before you show symptoms through the duration of that illness while you have a fever. So they say you should always stay home. They also say that you should still get a flu shot because even if you do get sick, that flu shot can lessen the symptoms. Reporting live, I'm Megan Hahn, 3 News Now.